The latest Ebola outbreak in Uganda was declared on September 20th. A case of the Sudan Ebola virus had been confirmed in Mubende district. Consequently, the virus spread to 7 districts, leaving 56 people dead, 142 cumulative confirmed cases, and 86 recoveries have been registered since. In accordance with World Health Organization recommendations, an Ebola outbreak is considered over when no confirmed or probable cases are detected and the last confirmed case is discharged from a treatment unit for a period of 42 days. And because it has been more than a month and not a single case has been recorded, the Ebola treatment centers will be scaled down.
We've scaled down in Madudu. We've downsized in Entebbe. Mubende, we thinned out of the regional referral hospital, but the other treatment center to the works department still remains. The treatment center in Kasanda still remains. The treatment center in Mulago is going to remain. And of course, the permanent treatment center in Entebbe is going to remain, but at suboptimal capacity.
Among those who succumbed to Ebola were health workers.
For those that were government employees, I can assure they will be compensated.
But as this outbreak ends, a number of frontline health workers are claiming they have not been paid for their services. According to Dr. Kyobe, it is important to integrate a clear payment plan for these healthcare workers.
The word is not paying. The word is potential late payment, which is also unfortunate. We need to make sure that we have the HR component starting to come in very early. Because as a doctor, I may not be the best person on how to manage human resources, plan for their remuneration and all this. So it is something that we are learning.
The Ebola outbreak called for travel restrictions, but a section of the public questioned whether the lockdown in Mubende and Kansanda districts was necessary. Ministry of Health says the travel restrictions enable the outbreak to be contained.
To me, the timing was appropriate. It was the most appropriate time because we had tried to stop people from coming to Kampala. Some didn't listen. Most listened, but some didn't listen. And you don't need many who don't listen to come to Kampala. And when you have 10, 20 transmission chains in Kampala, in busy settings, you have a challenge. And we had to stop that.
To date, the source of the first case has not been traced.
But what we know is that in the same area 10 years ago, President Kakumiro was part of Chibale. And then when you see Kakumiro and Chibale and Mubende, they are actually very close. So we think potentially the reservoir could actually be in that area.
Government will conduct a national review assessment on what was done right and what was not.
When you have the national authorities remaining in the lead, it's very critical. It's very critical. Partners are good, but partners usually come with a specific expertise, so to say, or interest of how they want to support.
Norbert Atkunda, NTV News.